good evening, good evening. This is the premiere episode of Truth Telling Time on TV. This program is brought to you by Imani Unidad, where we strive to infuse social justice into social and sexual health. So we will be talking about some of those kinds of things that other folks never talked about, but we just love talking about. And I have two wonderful guests with me this evening. Two ladies that I've had the honor and pleasure of working beside for years and years and years. And so I am going to pause for a moment and allow them to introduce themselves and tell us a little about the work that they do. And are you ready, ma'am?
I am ready.
Go ahead.
Thank you. Well, I'm Latoria Green, Tobacco Education Coordinator with St. Joseph Regional Medical Center, also coordinator of Smoke Free St. Joe, which is a community coalition of different organizations and individuals. We're all about making sure that we're protecting all workers when it comes to smoke-free air.
Okay. Just workers?
Well, all workers, so it's
Okay.
everyone. So we're talking about the whole community is what we're talking about.
Okay. All right. Thank you.
Yeah.
And I'm Sharon Burden, and I'm the Executive Director of the Alcohol and Addictions Resource Center in South Bend. And we've been in the community since 1962 doing alcohol and drug prevention education, information, referral, and advocacy services.
Okay. And so a lot of times when we talk about preventative health, keeping folks healthy, there's a lot of focus on the individual. But what I appreciate about the work that we do is that we also consider how relational everything is. An individual does not live in isolation. And so while social health is all about relationships, and the first and most important relationship is the relationship with one's own self. But I'm also in relationship with my family, like you said, my coworkers, my community. And so all of these parts affect my health as well. So I'm very interested to learn about, and I guess why I asked the question, the follow-up question, where you said workers' health. Is that the only focus of the tobacco cessation program?
No, not at all. In terms of Smoke Free St. Joe, that is pretty much where our focus is in making sure to protect all workers and making sure that no matter where a person works at, that they are able to breathe clean, fresh air. So that's one of our focus in regards to that. As far as on the prevention side of tobacco, we want to make sure that we're first and foremost preventing youth from actually initiating smoking, and then also for those who are currently smokers, making sure they're providing some cessation services for them as well too. So we're all about making sure that we're providing services for the whole community. So the community as a whole is who we really want to work for. But as far as, like I said, with the Smoke Free St. Joe, we just want to make sure that no matter where we work at, that we actually are able to breathe, clean, fresh air.
Okay. So I had the question, you work with tobacco and you work with alcohol and addictions, but I want to focus tonight primarily on alcohol because tobacco
They go hand in hand
and
sometimes.
alcohol not only go out hand in hand, but they go hand in hand because they're both legal.
Yes, yes.
And they're so socially acceptable. Well, not tobacco so much anymore, because I was telling somebody, when people first started smoking, it was the cool thing to do. Everybody wanted to be James Dean or the Marlboro Man. And now you see people cowering in doorways, really trying to hide the fact that, so there's some sort of shame and stigma that now goes with tobacco usage. And that's part of that whole community kind of relationship. So is that a part of what you guys are doing, trying to shame people and
that's
stigmatize
something that we
smoking?
try to make sure that we have people to understand that we're not against smokers. We're definitely not against smokers. We're not about shaming anyone because of the fact that they're a smoker. We understand that when it comes to smoking, it's about addiction is really what it's about. And so this is a person who really needs to break their addiction, and that's what it's all about. So providing them the resources that's available to them, that support system that's available for them to help them break that addiction. That's what we're all about as far as with that. And so it's kind of like we want it to be socially unacceptable because of the fact that we want to take away the glamorization when it comes to smoking. You know, like you said, you would see lots of posters, or you would see it in the movies and whatnot, the celebrities, and so it was kind of like the cool thing to do. So we want to just remove that of making it the cool thing to do. And just making sure that people understand it's about taking care of their health is really what it's all about, as well as the health of the community as well.
Okay. So, Sharon, why do you think we haven't been able to do the same thing with alcohol?
I wish I knew the answer to that. I think to some degree we have with drinking and driving, in that I think that 30, 40 years ago, it really wasn't such a big deal. A lot of people were okay with the idea that you could go to a party, you could drink as much as you want, and as long as you were careful, you could drive home. And I think over the years, that has changed to some degree. Part of that had to do with designated drivers. I think there was a real move. Unfortunately, the group that really took hold of that was mostly the social users of alcohol, the ones that were pretty responsible with their use anyway. So we know that some folks who are chronically dependent on alcohol are going to drink and drive, it seems like, anyway. But there has been a reduction in that respect, that it's not okay to drink excessive amounts of alcohol and get in a car. So we've seen some change with that. And I also think that depending on the age of a person, there's also, I think, less tolerance of people over consuming at parties, things like that. I think in the younger age group, there's often the intent to drink to get drunk, and I don't think we've made much of an impact on that. But I think in other situations with other age groups, there has been at least some recognition that low-risk drinking is a much better path than high-risk drinking.
Okay.
But we haven't made as much change as we could.
And speaking of young people, you hear a lot about marijuana being a gateway drug. But for most young people, just thinking of me and my peer groups, it was alcohol or cigarettes, because those are the things that's readily found in most homes.
Correct.
It's alcohol and cigarettes. So to me, those are the precursors. If there is a gateway something, you know, I remember the cigarettes I found under my sister's mattress. Now there was, well, when we were younger, when my parents were together, there was, you know, they'd have their parties and people would drink beer. And I remember one morning, you know, me and my brothers going in there and we going to clean up all the beer bottles and turning them up and getting a mouthful of ants.
Warm beer.
So to me, cigarettes and alcohol are the gateway drugs. And can you just kind of speak to that, the fact that in most homes there is alcohol?
Right.
Yeah.
And I think partly because for the majority of the population, the use of alcohol isn't a significant issue. You know, a significant number of folks are what we would consider low-risk consumers. They don't drink excessive amounts of alcohol. It doesn't cause them serious health issues. And so in that regard, having it in their home, why not? What we would hope that they would do, though, is limit access to those who aren't old enough to legally drink.
Right.
The reason the age is set at 21 is because the brain of an adolescent continues to develop till they're age 25. So the longer we can delay their use of alcohol, the better off. But having alcohol in the home is not a bad thing. What we think that is important is that they're very responsible about how it's maintained. You know, you should lock your liquor cabinets. You should make sure you know what's in your refrigerator in the garage. One of the easiest places for kids to get beer is out of the garage refrigerator. And at one point I remember there was a series of break-ins near one of the high schools. And that's all they took was beer out of the garage and the refrigerator, because that's where everybody knew it was. So I've given that secret out. So it's just a matter of being really responsible with it. And alcohol is a very accepted part of our culture. To some degree, it's been glamorized. I mean, they never show pictures of people sick, throwing up, making really horrible choices as a rule. So it has been glamorized, and it's been part of our culture in that respect. So it's a matter, I think, of the responsible use is what we have to really emphasize. And for those who aren't responsible in their use, we have to provide them with help.
And so when we bring in the whole social justice piece, which is about resource allocation, equitable access to, so say somebody has a problem, is there equity in who can access services if they need help with an alcohol problem or a tobacco problem?
Yes, and that's one of the things we try to make sure that we provide for people is cessation services, cessation options for them. One of the things that we always are touting is the Indiana Tobacco Quit line, which is a great resource. It's a free resource that people could call 1-800-QUIT-NOW, and they're able to get what is called well, more so quit plans with quit coaches, where they can get that, or they can get it through the web, or they can get it through text messages, whatever is best for that person. But you're guaranteed 4 counseling sessions, and that's a lot, you know, when you think about the free service. And if a person's uninsured, if they're on Medicaid or Medicare, they could qualify for 2 weeks of nicotine replacement therapy for free. And so right now they're only able to offer like patches and the gum, but at least it's something. It's a start to help a person out. Of course, if a person has private health insurance, then usually I would say at least 9 times out of 10 that they will at least have some coverage of tobacco cessation services for them, as far as like the patches or something like that. But definitely the quick line, they can actually walk them through that process and provide any information. But then also at the hospital, St. Joseph Region Medical Center, we're offering the free tobacco cessation program, Freedom from Smoking. It's a 7-week tobacco cessation program that's being offered for free for the community. So like I said, providing those options and those services that's available is not just saying, oh, put those cigarettes down. No, it's just a matter of saying, well, hey, put the cigarettes down, because we all know the health implications in regards to that. Like you were saying with alcohol use, there is like the susceptible, or at least the acceptable amount, you know, when it comes to alcohol. Well, it's not really the case when we're talking about tobacco, because even if you're smoking a couple of cigarettes a day, there's still the effects that the body is going through. There's still a process that's happening in the brain when it comes to the neurotransmitters and the nicotine. So our whole thing is, let's quit totally. But what a lot of people have been doing as well is that they've been substituting when it comes to tobacco usage. So maybe I might have put cigarettes down, but all of a sudden I'm picking up snuff, or I'm picking up some of the dissolvable tobacco products that are out there. So we're just a matter of making sure to provide service for people when it comes to tobacco cessation as a whole.
Okay, so not substituting healthy things like carrot sticks or celery sticks, which is what you would get in the counseling program.
Oh yes, and that's exactly what we cover. Yeah,
Right.
and it's to make sure, you know, I always tell them in my groups, let's not substitute one addiction for another. So, you know, like I said, putting down the cigarettes, but pick up the carrots, pick up some apples, maybe go take a walk if you're feeling like, you know, you're having those urges or those triggers, you know, maybe having to not go to that party where there may be some drinking, and, you know, and a lot of times cigarettes, smoking, as well as alcohol goes together. So maybe I may have to take a couple of weeks off, you know, from actually going to those parties. And so it's a matter of, and you learn those things, and that's why we want to make sure that people understand it when you're getting, whether it's through the quit line or through our classes, that you're going to get that great information and education to go along with it. So it's not just a matter of just telling people just don't smoke, you know, when it comes to that.
So how about alcohol treatment services? How about, are they readily accessible to?
Well, I think that if a person has private health insurance, they often have more options. The reality is that we've kind of come full circle in the community, though. When I first came to this area 30-some years ago, we had very limited services. And then we went through a period of time where there were treatment centers everywhere. They were all over our county, and they were in neighboring counties, and they were very accessible. And now we've kind of gone back to a time where we don't have as many services available. There's more limited options. A person has to really be their own advocate many times. If they have health insurance, they have to make sure that they're working with their provider network so that they get the maximum benefit. If they don't have health insurance, they need to make sure that they work through the system to get services that are affordable. For a person who has an alcohol problem, when the financial piece becomes the barrier, it's really easy to say, you know, I can't afford it, I can't do this. And one of the things we try to do is help them kind of work through that system so that they get the services that are available to them, be an advocate for them, help them understand that there are some state-supported services, how to access those services, as well as using services in the community like 12-step programs, which are free, anonymous, and offer people a great deal of support if they want to learn how to live without alcohol or other substances.
So is there any movement within the community to question, number one, and or maybe limit the accessibility of alcohol and tobacco to people with the least amount of resources and access to if they get in trouble?
Well, one of the things with Smoke Free St. Joe is that, like I said, we do have that community coalition that's all about promoting smoke-free air for all. So that kind of ties in. One of the things that we do know that if you limit the number of places that a person is able to smoke, that we know that that's going to decrease their consumption. You know, so that's really going to help them in regards to that. So being able to pass these laws that are more on the more broader scale, we know is going to have a greater impact when it comes to consumption. And that's something that we want. We want the consumption to actually go down as far as with that, because we know, like I said, with the health problems when it comes to smoking, whether it be lung cancer, COPD, so all these different diseases that a person can experience. But we want to be able to provide at least to make the environment as acceptable, I guess, when it comes to preventing tobacco usage as a whole. So we're all about trying to prevent the consumption of when it comes to tobacco usage.
Do you find yourselves in your work challenged by, let's say, capitalism? Because I know a big issue when you were all trying to get the resolutions, the ordinances passes, well, people were complaining about the disaffection of their businesses. And this last one didn't pass because it was only about South Bend. And they were saying, well, people can go to Mishawaka and smoke in places, and that'll disaffect our businesses and the dollar.
Yes. And there's been studies that's been